Dr. Annette Bosworth emphasizes that excess insulin is a central driver of many chronic diseases and accelerated aging. In a typical modern lifestyle, many people produce large amounts of insulin without realizing it, often stimulated by diets high in processed carbohydrates and late-night eating habits. This state of chronically high insulin is inflammatory and leads to the accumulation of metabolic trash or debris in tissues, particularly in the brain. Such buildup is linked to numerous conditions, including high blood pressure, cancer, depression, brain fog, Alzheimer's disease, and Parkinson's disease. The problem with excess insulin is that it not only promotes fat storage and weight gain, but also fuels systemic inflammation and impairs the body's ability to clear this metabolic waste. This insulin smolder runs quietly underneath the surface, often undetected, while quietly contributing to organ dysfunction and cognitive decline. Lowering insulin levels through diet and lifestyle is fundamental to improving health span and reducing disease risk. One of the earliest visible signs of insulin resistance, Dr. Bosworth explains, is an increased abdominal girth, reflecting visceral fat accumulation. Other subtle indicators include the presence of skin tags, small mushroom-shaped skin growths commonly found in areas like the armpits, and velvety darkened skin patches, medically known as acanthosis nigricans, often occurring on the back of the neck or in skin creases. These dermatological signs point to high circulating insulin levels affecting skin cell growth and health. Additionally, insulin resistance may cause a loss of hair on toes and legs in older individuals, as the body reduces blood flow and nourishment to these peripheral areas. These signs provide accessible clues to assess long-term metabolic dysfunction before more overt chronic diseases like diabetes or dementia develop. The ketogenic diet is presented as a powerful strategy to reduce insulin and successfully reverse or manage many chronic diseases. By drastically limiting total carbohydrate intake, typically under 20 grams daily, it forces the body to exhaust glycogen stores, decrease blood glucose levels, and lower insulin secretion. After the body depletes glycogen reserves, usually over days to weeks depending on the individual's insulin resistance, it switches to a ketogenic state where fat is burned for energy, releasing ketones into the bloodstream. This metabolic adaptation lowers systemic inflammation, promotes fat loss, and protects muscle mass preservation. Ketones serve as a cleaner fuel source than glucose, producing less oxidative stress at the cellular level. Patients on ketogenesis often experience improved energy, concentration, mood stabilization, and cognitive function. Dr. Bosworth introduces the concept of a keto continuum, a 12-step process guiding patients through progressively advanced ketogenic practices to maintain fat burning and metabolic health lifelong. The initial stages correspond to beginners reducing carbohydrate intake and beginning to produce measurable ketones, often detected via urine strips. Subsequent steps involve incorporating time-restricted eating or fasting windows, gradually extending the fasting period up to 16 hours or more, and eventually incorporating longer fasts between 36 and 72 hours to deeply reset insulin sensitivity and metabolic pathways. This structured approach encourages sustained lifestyle change beyond temporary dieting, allowing the body's metabolism to restore cellular renewal and waste clearance through repeated cycles of ketosis. To tailor dietary interventions effectively, Dr. Bosworth underscores the importance of monitoring one's blood glucose and ketone levels. Blood testing remains the gold standard, with devices available to provide real-time feedback on glucose and beta-hydroxybutyrate, a primary ketone, concentrations. The ratio of glucose to ketones, dubbed colloquially as the Dr. Bosworth ratio, helps assess the degree of insulin resistance and fat burning occurring in the body. Urine ketone strips provide an easy but less precise alternative, particularly in the early phases of keto adaptation. Continuous self-monitoring empowers patients by making invisible metabolic processes visible and actionable, fostering adherence and adjustments needed to reach therapeutic ketosis. One of the most compelling aspects discussed is the brain's ability to utilize ketones as an alternative fuel, especially when glucose metabolism is impaired by insulin resistance. In conditions such as Alzheimer's disease, which Dr. Bosworth notes is often referred to as type 3 diabetes, the brain struggles to efficiently use glucose, leading to cognitive decline. Ketones can cross the blood-brain barrier independently of insulin pathways, providing neurons with clean, sustained energy that reduces oxidative stress and inflammation. Clinical experience shows that ketogenic diets can improve concentration, mood, and mental clarity, even in patients with early neurodegenerative disease, sometimes reversing symptoms and significantly enhancing quality of life. Dr. Bosworth advocates the Sardine challenge as a practical and nutrient-dense method to help break patients into ketosis. Sardines are rich in healthy fats, high-quality protein, and key micronutrients like vitamin D and omega-3 fatty acids. By limiting patients to sardines exclusively for several days, she simplifies the diet enough to overcome barriers and rapidly reduce insulin levels. This approach also helps patients experience true satiety and reduces complex decision-making around food choices. She debunks myths about potential toxin exposure through canned sardines and supports their safety and efficacy based on her clinical observations and laboratory testing. Even within ketogenic diets, certain supplements play a vital role in optimizing health. Vitamin D is highlighted as a hormonal powerhouse that affects every cell, improves immune regulation, and often remains sequestered in fat in insulin-resistant individuals. Sardines themselves provide natural vitamin D, which can increase significantly as insulin resistance improves. Magnesium supplementation is almost universally warranted due to soil depletion, poor dietary intake, and increased excretion during ketogenic adaptation. Dr. Bosworth also finds methylene blue compelling as a mitochondrial enhancer and brain energizer with a long history of safe use. Additionally, creatine supports mitochondrial energy, cognitive function, and physical performance, even benefiting jet lag management and mental fatigue. Discussing weight loss, Dr. Bosworth describes the complex hormone environment that governs appetite and fat storage. Hormones such as GLP-1, glucagon-like peptide 1, play a crucial role in regulating satiety and blood sugar control. These gut-derived hormones are often suppressed by obesity and insulin resistance. She explains that ketogenic diets naturally raise endogenous GLP-1, thereby reducing cravings and helping with appetite suppression without the need for pharmaceutical GLP-1 agonists, although those drugs have a role in some patients. She stresses the importance of restoring hormone balance naturally through diet, lifestyle, and occasionally supplement support before resorting to medication. Ketogenic states not only assist in fat loss, but also preserve and at times enhance muscle mass and strength. Dr. Bosworth shares findings from studies on military personnel, showing that while initial performance on keto may seem unchanged or slightly diminished, longer-term ketogenic adaptation, beyond 6 to 18 months, leads to measurable improvements in physical power and endurance. Lower systemic inflammation accelerates muscle repair, reduces soreness, and aids recovery, which is especially important as people age. Preservation of lean body mass is critical for healthy aging and quality of life, and ketones appear to provide protective signaling that spares muscle from catabolism during weight loss or medical treatments such as chemotherapy. Dr. Bosworth shares poignant, personal experience using ketogenic diets as adjunct therapy for her mother's cancer, where her ketogenic intervention contributed to a dramatic 70% reduction in tumor markers over 6 weeks. She emphasizes that many cancers, particularly those influenced by insulin pathways, rely heavily on glucose, and ketones selectively starve these malignant cells while nourishing normal tissues. The ketogenic diet creates a less inflammatory and less cancer-friendly environment. While not a cure-all, it can improve patients' tolerance to treatments, preserve muscle mass, and improve quality of life. She counsels that ketogenic therapy should complement, not replace, standard oncology care, and requires clinical oversight. The podcast concludes highlighting the psychological and emotional challenges of maintaining lifestyle changes required for metabolic health. Dr. Bosworth notes that most individuals come to her practice during a crisis, but long-term adherence demands a deeply personal why, an internal motivation that outlasts short-term fear or discomfort. She recommends structured mindset work to identify the core insecurities or driving forces that fuel perseverance. Motivation is nurtured by small wins, accountability, community support, and addressing emotional wounds around food and self-care. This inner work is essential to sustain the disciplined behaviors of ketogenic living and overall health transformation.